Mental health front and center today at City Hall, specifically how best to tackle it going forward in Chicago.
WGN's Brona Tumulty joining us now with details on that. Brona.
Good evening, guys. Yeah, today was the start of how we begin to address mental health in Chicago. We heard from professionals from other areas about what has worked for them. For example, matching police salaries was something that helped Albuquerque get the right crisis responders in place. Now, the goal, though, overall is to build a system that is more accessible, diverse and effective for all.
We want to come together and build a system that will work for the city.
Alderwoman Rosana Rodriguez Sanchez is talking about what the future of mental health care will look like for Chicago after leading the first committee hearing today on health and human relations at City Hall. Among those gathered, health professionals from other cities explaining what has worked for them.
It's a lot of opportunity to build on what other cities have done and learn on the successes.
The Alderwoman has been working in tandem with the Collaborative for Community Wellness, a movement of 70 organisations around Chicago. Their goal is treatment, not trauma.
What we're trying to do is develop the right tools to address a lot of the things that we are throwing at police right now.
Some of those tools might include a 24-hour hotline for mental health emergencies, the establishment of community-based healthcare teams, and the elimination of sending police officers to respond to clear-cut mental health crises.
We use a lot of money in trying to put band-aids over things. We use a lot of money in dealing with the aftermath of not having those systems in place.
Alderman Desmond Yancey among those sharing personal perspectives on the matter today.
This issue became personal to me in December 2009 when my friend Alvin Nash, who was a veteran, a Navy veteran and a union organizer, was suffering through a mental health crisis. And out of an abundance of caution, his family called 911. Armed police showed up, and moments later, Alvin was dead, shot and killed in front of his wife and son on Christmas Eve.
It follows a commitment by Mayor Brandon Johnson during his campaign to get mental health clinics reopened around the city, some of which were shuttered almost a decade ago under Rahm Emanuel's administration.
My administration is going to reopen mental health clinics that are publicly funded and publicly held.
To get back to where we were then, we'd need more than a dozen reopened.
Originally, Chicago had 19 public mental health centers that serve the whole city. 14 of those were shuttered.
But how much will all these measures cost? Well, that's the multi-million-dollar question. But the price on doing nothing could be a lot more costly.
Whenever we talk about public health, we talk about cost, but we don't see it as an investment. Let's find a way to build this system so that we can actually cut costs in dealing with the aftermath of not having those systems in place.
Now, we're told the next step is to create a group comprised of people from a lot of different sectors in the city, including representatives from the big health unions in town, so that collectively they can decide how best to push Chicago forward.